I've been a swimmer my whole life, a competitive swimmer, and it's really part of my life. So about 10 years ago, I started waking up with headaches, and I felt really fatigued, and I thought it might be something to do with my sleep, so I wanted to find out.
There's a huge spectrum of sleep disorders, ranging from problems with insomnia or falling asleep at night to problems with excessive daytime sleepiness during the daytime. Sleep apnea is the most common sleep disorder that we see that has any medical significance. Sleep apnea is a very serious condition. It can have a tremendous impact on the severity of sleepiness and the ability to function during the daytime. Patients with sleep apnea are at a higher risk of traffic accidents, often perform poorly at work, even have problems relating to family at home.
So in somebody who does not have sleep apnea, you expect the heart rate to stay constant. And then when you're breathing, like you're breathing now, there's just a nice up and down, regular pattern of breathing like that. Okay? Somebody who has sleep apnea is completely different. You'll see these normal patterns of the heart rate going along nicely. You'll see the chest movement up and down, and then you'll see the airflow go up and down, and then all of a sudden it just stops. So what we're doing in those in the lab is we're counting how many of these apneic events that you have. So what we want to do is we want to stop this from happening.
I'm proud to work at the Group Health Center for Sleep Medicine. We have the largest group of boarded sleep physicians in the Pacific Northwest. We have a state-of-the-art sleep lab and a very innovative home sleep testing program that we've found quite successful.
The studies that we conduct in the sleep laboratory and the studies that we conduct at home are both sleep studies. The majority of people who have obstructive sleep apnea can be diagnosed at home, and for them it's a lot easier to be at home. It's a more normal environment. They're going to sleep in a way that's closer to the way that they usually sleep. So in that way it gives us a very accurate presentation of their sleep patterns.
I don't have to convince people to get tested, but I do have to convince them to pursue the treatment, because the treatment is very unattractive. The best treatment, and it's evidence-based, is the continuous positive airway pressure system, also known as CPAP. That's basically a mask that's attached to a hose in a machine that generates air pressure, and it continuously does that to prop open your airway so that your tongue isn't blocking your airway at night, preventing air from entering. So it's stenting your airway open, basically.
I mean, you can sleep on your side, side to side, on your back, and you won't notice it.
And if you need an adjustment in your mask or a different product, I mean, the product knowledge alone is staggering. They know what's out there. They know the latest and the greatest. They'll listen, lay you down, try it on. If you don't like it, let us know. They want you to sleep comfortably. And really, with the end goal, they want you compliant with, your sleep therapy.
Families are huge. It's hard enough for patients to accept that they're going to have to be using a machine at night and wearing a mask. And so it's always nice to have their partner say, whatever you need to do, I'm behind you on it.
He had spent how many years waking up with body aches, knees hurt, he was feeling like an old man, but he woke up and said, I don't hurt. It's not the most attractive thing to wear to bed, but breathing is just a heck of a lot sexier.
I'd say I got used to the mask fairly quickly because it really changed the way I slept and the way I felt. I woke up refreshed, and I didn't have the headaches, and my swimming feels better than ever.